The use of Botox in treating bruxism and clenching. Bruxism and clenching is a subject that I face daily in my practice. And bruxism happens because of acidic reflux of the IG, or because of stress or lack of sleeping. So many reasons behind bruxism. We use Botox to reduce the strength of the masseter muscles. Patients used to do night guards or occlusal guards, but the problem with occlusal guards or night guards that they are only protecting the teeth without solving the problem. But with Botox, we can, to a big extent, reduce this problem and make the masseter muscles less active and weaker, so the patient will not suffer the nocturnal bruxism.